So hi everyone, good evening. Thank you so much for being here. And thanks for your flexibility. Sorry that the food was a little bit late. So I'm Allison Phillips, Executive Director of the Stanford Center for Innovation and Global Health. And I'm really excited that you're here for this Faculty in Focus event with Desiree LaBeaud. I know. Thank you for knowing her spirit, because this is, she's all about community and she's about joy. So I appreciate that. So Desiree, as you know, is an inspiring leader in pediatric infectious diseases and community engaged research, and she's a mentor to many aspiring global health practitioners. Anyone here? Anyone a mentee? No? Okay.
Yeah.
Maybe.
There's one.
Mira. Okay, we have Mira, the brave soul who came forward. So Desiree is also an eloquent advocate for health equity. And before I introduce her, I'll briefly share some information about some news and opportunities from CIGH. So these faculty in focus series we're trying to do on a monthly basis, and they're really student-centered. We do them because med students came forward and said that they wanted more opportunities to connect with Stanford faculty involved in global health. So we try and do them on a monthly basis. Next month, we'll have Bonnie Maldonado, who's coming to speak with us about COVID-19 and monkeypox. Thank you. It's up there. COVID-19 and monkeypox lessons learned about pandemic preparedness and global vaccine equity. December 5th. We have a couple of other events here on the slide. Iran Ben David is amazing. Also, if you don't know him, he's talking in February in the same series. So some other ways to engage with our center. So do we have any postdocs in the audience? Maybe. Okay, there's one brave soul in the back. So we recently launched a global health postdoctoral affiliate program. So you can apply to that, and it's a way to bring postdocs together who are all involved in different disciplines related to global health. So please apply for that. And for med students, I know we have a few, right? Right, yeah. So we have a brand new global health med student research fellowship, which is a brand new program. I think it might be one of the first in the country that we're offering, which is a one-year global health fully paid research fellowship where we're able to offer it to 2 Stanford students next year. And fellows would spend the fall quarter on campus taking courses, preparing for the research, and then the next 3 quarters in the field conducting research. It's a really cool offering. So please apply. Applications are due in January. We have other opportunities. Look on our website, things coming up, the Global Health Media Fellowship, Planetary Health Postdoctoral Fellowship, and other events and global health courses, which we advertise. Oh, and we also have a survey because we like your feedback. We want to hear everyone's feedback about our website and our offerings and what more we can do. There's a QR code on a flyer somewhere. Josefa. This is Josefa. She's amazing. She may be emailed with you all. And we have Ola in the back. Ola is also on our team, and she's okay. So I mentioned a little bit about the Faculty in Focus series is student-centered. So the format of tonight is that Desiree will talk about her global health research and her career for about half an hour, and then Kumar, say hello. He's a medical student here at Stanford and co-chair of Organization for Global Health. And he'll walk us through the Q&A portion of the event. So thank you, Wasan, for doing this again. Okay, now on to our superstar of the evening, Desiree. So Desiree is a core member of the CIGH leadership team. She's a professor of pediatrics and infectious diseases, a senior fellow at the Woods Institute for the Environment, and professor by courtesy of epidemiology and population health at Stanford. She's a physician scientist who has devoted much of her career to better understanding the risk factors and long-term health consequences of arboviral infections, including Rift Valley fever, chikungunya, and dengue, particularly for children. She's conducted field research on infectious diseases for nearly 20 years, including in Kenya, where she's cultivated long-standing partnerships with local researchers there. She's also advanced innovative multi-sectoral work to get to the environmental roots of many public health challenges, including plastic pollution. And she also has research in Brazil and Grenada and maybe more parts of the world as well. A couple more places, of course. We'll hear more about it. Perhaps what most distinguishes Desiree's work is her unwavering commitment to working alongside the communities where her research takes place, with the goal of ensuring the research serves local needs. She also goes beyond the research to translate the academic findings into meaningful health improvement through education, policy change, capacity building, and more. And we've had the pleasure of partnering with Desiree and her Kenyan partners in the flagship project of CIGH's Action Lab for Planetary Health. One of the more recent manifestations of Desiree's commitment to impact is the founding of a nonprofit called HERI, Health Environment Research Institute, to address the interrelated problems of plastic trash and mosquito-borne disease in Kenya. And I know she'll tell you more about this tonight. On a more personal note, Desiree is one of my favorite people at Stanford. She's amazing. She's wonderful. She brings light and joy and love into everything that she does. And she's also a mom of how many boys do you have? 3. So, I mean, just a pretty amazing role model and person, and a definite pillar of the global health and planetary health community at Stanford. So, Desiree, thank you for being you. Thank you for being here.
Okay. All right, can you hear me?
Yeah.
Great. Thanks so much for coming out on a Wednesday night. And thank you for that really lovely introduction. Allison. I can see you. I'm really short, but I can see you. So, you know, it's really my honor to be here today and to be asked to do this. And I was so excited because I heard that this is mainly for students, right? Bringing a lot of students and kind of talking about your path and how you kind of got to where you are. And so that's what I'm going to share with you tonight. And I'm going to talk about our research and how it led to community engagement at this intersection of climate change and plastics and health. So I was thinking about this talk. I was thinking about, you know, when kind of this part of my life really begun. And it took me back to medical school, actually, when I, for some reason, was just interested in doing global health. But there weren't any global health opportunities at the medical school I was at. And so when I chose pediatrics, I was like, I'm definitely going to find a global health opportunity in peds. And so at that time, there were only 2 programs in the country that had a global health track. You can't even imagine it now because every single one has one now, right? But I ended up going to Case Western Reserve University because it had a pediatric global health track. And as for my international rotation, I went to Vientiane, Laos. And so there I was, you know, a second-year pediatric resident on the wards, and I was taking care of kids that were in the pediatric infectious disease wards and the regular wards. And I just had this sneaking suspicion that if I had some infectious disease training, I might be a little bit useful there because I felt really kind of useless. And so I went back home and decided to pursue infectious disease and did my infectious disease fellowship. But something else happened in Laos. Actually, I happened to be in Laos during monsoon season, and there were heavy rains, lots of floods, and there was actually a huge dengue epidemic that happened there. And so I actually saw a lot of kids die of dengue. And, you know, I think that stayed with me and probably had an impact on me, and is probably one of the reasons why I ended up being an arbovirologist, someone who studies dengue, right? So I got back home, you know, back to Cleveland. I was at Case and Rainbow, and I'm doing this infectious disease fellowship, and I really want to do global health work. And so there's a Center for Global Health and Disease at Case. And so most of the people there work in sub-Saharan Africa, and that was exciting because I'd always wanted to go to Africa. And so I interviewed with everyone, and I met Charlie, who has been my mentor for the last like 19 years. And he's actually just a psoriasis expert, but he had this side project on something called Rift Valley fever virus that brought me to Kenya and brought me to these really, really remote areas in Kenya. As you can see there, where like, you know, zebras and giraffes are crossing the road. And I was working on Rift Valley fever virus. And I was in these areas working with these really impoverished, isolated, and underprivileged communities. And I fell in love with Rift Valley fever virus. I recognized right away just how important relationships were, and collaborations, and real partnerships, bringing community members and our researchers to the table with us. And you know, I'm looking at this picture here. This is an old picture from 2008, I think. And a lot of our team members there actually have passed on, right? So I've made these like really deep connections with our team members. And hopefully you guys won't fall asleep, but if you do, have a good nap. I fell in love with field epidemiology. I fell in love with community health. I fell in love with sort of impoverished populations, and I really fell in love with Kenya, right? So Rift actually is incredibly climate connected. So Rift Valley fever virus, which remains my favorite virus, is a virus that actually initiation of outbreaks happen when there are these really heavy floods and seasonal rains, right? Enso events sometimes that cause all of this flooding. And what happens is when you have these floods, you have these like flood water 80s eggs that are there that already have virus in them. And so when the floods come, you go from like 0 to 1 million mosquitoes, and a huge bloom of virus happens. And those mosquitoes bite the animals and they get sick, and also bite the humans, and we get sick. And so Rift is intricately climate connected, right? And as we all know, there's like a lot of extreme weather events now. They're happening more and more. And so again, it was just like another echo of how climate is related to disease right now, especially these vector-borne diseases that I was studying. This is just like one of our households in our study. This is the dry season. And then that, that's the rainy season, right? So it's incredible, right? And so I was studying Rift, and I was in Cleveland, and I was going back and forth to Kenya quite a bit. And I started getting, you know, well, I got a lot of mosquito bites in Kenya. This was one of them, that's my leg. But I started thinking like about other mosquito-borne viruses. Like they probably have to be here, right? Like there's all these mosquitoes, we know there's Rift. What about like all these other mosquito viruses that I know about and have seen in other places? And the thing is, you know, what if the fever isn't malaria, right? So again, working in sub-Saharan Africa, anytime a kid, you know, has a lot of mosquito bites and gets a fever, it's automatically presumed to be malaria, right? But in many cases, it isn't malaria. And so the deal is that, you know, most of the control for malaria, of course, is around the, you know, insecticide treated net, right? That protects you from the night biting mosquito. But the infections I was thinking about and finding in the freezers as I was freezer diving in Charlie's freezers at Case, and finding out that there was this burden of arboviruses, you know, this mosquito net isn't going to work, right? Because it's not a night biting mosquito, right? Like this bad girl bites during the daytime. So this is the Aedes aegypti mosquito, and she is a very efficient transmitter of human disease for many reasons. She transmits, you know, yellow fever, Zika, dengue, chikungunya. First and foremost, she prefers to feed on us, right? So she loves human blood. She loves to live around us in our habitats. She prefers to breed in our containers, our man-made plastic containers. And she is kind of a nervous Nelly. So like if she lands on you and she bites you and you move a little bit, you know, she'll go and bite someone else. And it takes her usually 4 or 5 bites to get a full blood meal to lay her eggs. And so she could have transmitted all of those viruses to all of those people, again, making her a super bad girl and a very important transmitter of these viruses. So about 10 years ago, I got the opportunity through an R01 to really figure out, you know, all of this exposure to these mosquito-borne viruses, right? I was freezer diving and finding all of these arboviral exposures and all sorts of people in Kenya. But just being exposed to the virus doesn't necessarily mean that you have disease, right? There's a lot of asymptomatic infections. And so I was really interested in trying to uncover whether or not anybody was really getting ill with these things, right? And so we set up this longitudinal cohort study across Kenya in 4 sites. So 2 on the coast and 2 on the west side of Kenya. Kisumu, which is there on the bottom left, which is the 3rd largest city in Kenya. It's on the beautiful shores of Lake Victoria. And then Ukunda, Diani, which is our coastal site, that's an urban site in the coast, and then 2 rural sites, Chilimbo and Sambweni. And what we did there, I'm a pediatrician, right? I focused the study only on children. I wanted to know, okay, are the kids getting these infections and are they getting sick? So what did we find? Well, turns out the kids are getting these infections and they're getting sick, but luckily they're not dying like in other parts of the world. But there's a lot of disease that's going on, you know, a lot of exposure, a lot of disease. We also studied the mosquitoes at all their life stages here, and we found out a lot about vector ecology and found out that all these Aedes aegypti mosquitoes are alive and well and breeding in our communities and infected with these viruses. And then we studied climate. So we measured temperature and rainfall, and then we were able to associate that and actually use climate data alone to actually predict both mosquito abundance and disease risk, right? And as I started working in Kenya over the years, I've actually, you know, when I first started, there was no one really knew that much about arboviruses. Everyone was mainly focused on malaria. But over the years now, almost everyone knows someone who's had dengue or chick. And they've gotten much more common, right? And there's a lot of reasons for that. Across the world, these diseases are emerging. And it has a lot to do with the fact that we live in a modern world, right? We live in a very urban world that's crowded and unsanitary. We change our land, right, which disturbs and provides new mosquito habitat. Unfortunately, there's a lot of military activities and war, which really kind of stop any kind of control or surveillance that were going on beforehand. We have a very limited toolkit when it comes to vector control. And then we live on a tiny little marble. And we're all very connected. You can get anywhere in the world within 24 hours, right? And so can sick people carrying viruses to new places where the vectors are waiting for them. But also climate change, right? So we have all these natural disasters, extreme weather events. A student in our lab, Cameron Nazrat, actually did a study just linking floods in our area to increased dengue. Okay, but we also have data that suggests droughts also can lead to increased dengue. How can this be? Well, it's because people don't have access to safe, reliable water. And so they store water in unsafe containers that are uncovered, and those become mosquito breeding grounds for Aedes aegypti. So again, uncovering some of the inequities in health across the world. And we've used a lot of this data, a lot of our climate data. I work with Erin Mordecai here at Stanford. I don't know, I'm sure many of you know her. She's an incredible biologist and modeler. And we've actually recognized that what's going to happen with a warming world is we're probably going to see shifts in some of these diseases that we study. So malaria, the malaria mosquito actually likes it fairly cool, around 25 degrees. And so as the world warms, there will be places that might get a little too warm for malaria, and you might actually have decreased malaria incidence. But then other places will see malaria, right? And with dengue, it turns out Aedes aegypti likes it hot, 29 degrees. So as the temperature warms, there's just going to be more and more of sub-Saharan Africa that's actually at risk for dengue. And again, this is super bad news because we're not prepared for it, right? Again, all mosquito control is directed against Anopheles, which is the malaria vector. The healthcare providers and policymakers don't know a lot about these infections or how to take care of them, how to rule them in, and we have very limited diagnostic capacity on the ground. So we have a lot of work to do when it comes to education and promoting policies in the Ministry of Health and so forth. So with all that, it was like, okay, so now I've spent like a long time uncovering this great burden of arboviral disease. Okay, so now it's time to do something about it. It's time to intervene and actually stop it from happening. And we knew exposure was common. We knew people were getting sick, and all these outbreaks, dengue outbreaks, chikungunya outbreaks, going completely unrecognized by health authorities. And we knew those bad girls were everywhere with virus, feeding on people and making them sick, right? The Aedes aegypti mosquitoes. And I work with a lot of entomologists, and we actually recognized that it seemed like, these mosquitoes preferred certain containers to other containers, right? So we thought, well, maybe we can target these containers and then, decrease incidence of disease and really make these invisible risks visible, okay, for communities. And so we spent about a year doing some formative work and, fully recognizing that the communities knew a lot about the malaria mosquito and how to protect against it, but very little about the dengue mosquito, right? And as we went through, we're doing a lot of vector work also, along with our community work. we started recognizing, wait a minute, it's really not about the container. And this is actually fairly obvious, right? It's not the container that matters. It's actually the purpose of the water in the container. And this makes total sense, right? If you have a container, even if it's an unsafe, uncovered container that's just sitting around, but you're going to use it to like drink or wash or do laundry or whatever, the water is going to go away. Mosquitoes need about a week to develop from egg to adult, right? And so there's enough time, you're going to use the water before the mosquito can develop. But it's that non-rainy day water, right? It's the water that you have sitting in an unsafe container because you don't have safe, reliable access to clean water that just sits there with no purpose. That becomes your backyard mosquito breeding ground, right? And we found that 81% of our larvae were in these containers with no purpose, right? So then Jenna, who is the PhD student there, she's now a postdoc at Stanford. She was an EIPER student and worked with us on this project and led it. We thought, okay, let's target these non-purpose containers with like a school and community-based intervention. So we devised this grand plan. So we had 10 schools along the coast of Kenya, and it was a case control design. So we had 5 case schools and 5 control schools. And we had this huge educational intervention that we did. And then we had the parents of the kids in these schools who we also trained door to door and awareness built about, doing larval source reduction, cleaning up your yards, getting rid of these breeding grounds. And with the kids, we really tried to promote their self-efficacy as agents of change. We made them like mosquito hunters and scouts. We gave them badges. We taught them how to, dump out standing water and save their families. And it was lovely. Jenna made this mosquito tag game, which is there on the left, where over the week it got more and more complicated, where they learned more and more about the mosquito life cycle. And it was a really interactive curriculum. And on the very first day, we, by the way, let me tell you what I taught them, but we taught them about, the mosquito life cycle, what the mosquitoes look like, that there's different kinds of mosquitoes and they bite at different times of day, and the sort of diseases that they spread, and then how to protect yourself from all those mosquitoes, right? And on the first day, we brought in like the vectors, right, at all the different life stages, showing them the little wiggly worms in the water and all that, the mosquito larvae. And we said, okay, now that you know what these look like, go out into your communities and find them, right? Find these mosquito larvae. So they came back the next day, Tuesday morning, and they're like, we found them, we found them. We're like, where'd you find them? They're like, in all the plastic trash behind our houses. And so Jenna and I were like, okay, let's add a community cleanup of plastic to our project, right? So we took those 250 school kids, and we kind of pitted, the 50 from each school against each other, a little friendly competition. And we said, okay, you've got a month. Here are some sacks. Let's pick up as much plastic as you can around your houses, and, let's have a little competition. And so over a month, 250 school kids picked up over 17,000 plastic containers, over a ton of plastic waste. And then Jenna and I were like, oh my God, we have a ton of plastic waste here. And so we tried to repurpose as much of it as we possibly could. We repurposed 4,000 containers, and we planted native tree seedlings that then we planted around the schoolyards and in the community areas and in the households. And it's really cool because now whenever I visit Kenya, we have all these little forests to visit, which is really nice. But still, we had a ton of plastic waste to deal with, and there's no recycling in Kenya. So we had 2 choices. You could either burn it or bury it. So we buried it. But you can't feel good about burying a ton of plastic waste. And so this led to the crisis that we're in, right? I mean, this is like our entryway into the plastic pollution crisis, which, as you can see from this graph, we are using plastic. Plastic is being produced at astronomical levels that are exponentially increasing, and there's no stopping in sight at this time, right? And we know that all these plastics have really an impact on health, right? I mean, I've been talking about the breeding grounds for mosquitoes, right? But also they're breeding grounds for other vermin like rodents that can spread diseases. We know that plastic, as I mentioned, plastic gets burned. 75% of it gets burned in sub-Saharan Africa. So that means it leads to air pollution and the 10 million deaths from air pollution in the world. Also, plastic attracts hydrophobic pollutants, right? That it kind of, we know we all have all these micro plastics in our body that we're ingesting in all our food and water and everything. And with it comes potentially toxins, right? With the plastic. And then of course, food security, right? Like plastics harm our marine biodiversity. And of course, a lot of people in the world depend on our marine food chains for sustainable sources of protein. And so this has huge impacts on food security for folks. And I'm a major optimist. You have to know that about me if you can't tell already. And so, yeah, where I see great challenges, also like great opportunities, right? So we have all this plastic laying around in our communities in Kenya, like breeding mosquitoes, making people super sick. So if we clean it up, there will be less mosquitoes and fewer people will be sick, right? And no one is really cleaning it up right now, right? So there's an opportunity to really scale these behaviors of cleaning up and upcycling and recycling and doing something with all of this, right? And we have a model for this. So glass and metal are 100% recycled, picked up, done with stuff with, right, in Kenya. And so maybe we could figure something out to do with all of this plastic. And so what we started with was this trash to treasure project, collecting trash for profit to reduce vector breeding sites. And so this is a project funded through BOVA, which is building out vector-borne diseases in Africa. And what we decided to do was actually create a business incubation program for people who are in the informal recycling trade. So there are these guys, and they're all men, so I can call them guys, called yard shop operators. And so they usually buy plastics from like waste pickers. They buy the plastic from them and then kind of sort it, clean it, and then sell it in bulk to middlemen who then sell it to like factories in Nairobi to make something out of it. And so what we wanted to do was work with these businessmen to really optimize their business models so that they could, make more money, hire more people, get more plastic off the streets so it's causing less havoc for people. And then also provide them a lot of health and safety training and let them know that if they don't cover their plastic and get it out, it actually becomes a breeding site for their communities, right? So they are sort of heroes of the community because they're picking up all this plastic, but then also there's some risk there, right? So they need to do it in a way that isn't going to make it risky to have all that plastic around. And so anyway, this project went for 4 years and it led to an increase in plastic waste volume traded. They made more money. There was less fluctuations in prices. We got all of them to work together and really kind of advocate for them, their business and work with policymakers, create this strong peer network. And we did have significant reductions in Aedes aegypti breeding, but there was still a lot more to be done. So in our work, working with the community, a lot of the qualitative work we did, we actually realized that the community members, they needed a lot more awareness building. And there was a lot of stigma around working with plastic, right? Or not plastic, but just trash, right? It's like dirty, right? And so we needed to create more community awareness, improve waste infrastructure, and really streamline both sanitation and recycling operations, create a market to incentivize recycling businesses, work with the policymakers to really explore and enact policies that were going to support recycling and recycling culture, and then really cultivate a recycling culture, kind of shift mindsets, right? And circularize an economy of waste in Kenya, on the south coast of Kenya, and really bring the science along with it. And so we felt that research can do a lot of things, but it's difficult for a research program to do all of these things. So we felt like we needed another way to affect change. And so that's why last year we founded a nonprofit. And so the nonprofit is called the Health and Environmental Research Institute Kenya. And the dream here is really just to translate all that science that we've been working on for almost 20 years now into really actionable community messages, right? And really improve health of the environment and our communities on the ground in coastal Kenya. And this is the CBO at the beginning. So it's made up of local folks who are from Diani, right? That is the CBO. CBO stands for Community Business Organization. And the guy here standing in the middle is my long-term research collaborator, Francis Machuku. And so now we have like about 60 members of HERI on the ground in Diani, but it has been wonderful and we're just getting started. So this new nonprofit, the whole point of it is to really empower people to take up this problem, build awareness, and really get a lot of community engagement on these issues. and really kind of change the norms, right? Destigmatize trash collection and create these strengthened relationships by everybody already working in this space. And there are a lot of people working in this space. You know, I'm thinking, I just want to say something. Did this slide come up? Did I skip over it? Yeah, because I'm like, wait, I didn't get to say this. So where we're working is the perfect place to do this work because Diani sits on the beautiful Indian Ocean coast, okay? It is like the highest tourist destination, like coastal tourist destinations in Africa, right? So it's like a beautiful place. And so people can really feel the impacts that plastic is making because they see it on the ground, right? It impacts tourism, it impacts, again, like disease burden, right? They smell it, they inhale it, right? Because there's plastic burning everywhere. And then they see it because many people work in the ocean, right? There are a lot of fishermen and they see, you know, the turtles being choked by plastic. They see, you know, the fact that their fish yields are less, right? They know what's happening. And so it really is a perfect place to do this work. Okay, I just skipped that. I needed to say that. And so what we're hoping to do really with this nonprofit is to get all of the people, like I said, who are working, Diani, already around this problem, like together, working together, right? More together, stronger together. And we're going to create a lot of jobs in this recycling space, decrease these trash-related health risks. Really, we're working with the policymakers quite a bit to change the policies. And then we're training a lot of students, right? So we have community engagement partners from local universities, and so we're and abroad universities, and so we're training students in environmental health so they can like take up this cause for the future, right? And then in the end, hoping to improve the trajectories of health for people in our planet. And lucky for all of you, 2 weeks from tonight, we have a virtual event, right, where we're going to talk all about HERI and like what we're doing and what we're accomplishing. It's really, really exciting. We now have buy-in from the government to actually start the HERI Hub, which is a sustainability education hub for our community members and grow out businesses from that. So please join us, be part of our village. I want all of you there because it's a good time and it's good work. So in the end, like what we're really trying to do is just circular economy of waste, right? So not even just plastic, but actually all waste, right? And my dream, I always bring this up. If anybody out there has $250,000 they'd like to give me, this is the H280 unit, which is an anaerobic fuel cell, okay? And it's charged with these bacteria called Eikenella sakiensis, which has figured out a way to eat plastic as its food. So you all know plastic is made from oil, right? It has a ton of biological energy in it, but it's difficult to break those initial bonds. Well, this bacteria has figured it out. And so and it eats PET plastic, which is the water bottle plastic, which has like no value on the informal plastic trade market. And so what happens is the bacteria eats all that plastic and then it spits out 2 things. It spits out this digestate, which is an incredible fertilizer that you can use on crops, very nitrogen rich. And then this methane rich gas, which can be harnessed to power something. So what I'd like to do is back an aquaponics unit into it and then have women lead a business in aquaculture using chewed up plastic, right? So we're getting the plastic up, we're, you know, have a business model for females in this space. And then also, you know, aquaponics will help with the overfishing of the oceans. We can grow some medicinal plants and veggies and things. And I think it would be amazing. So that's one dream. The next is a dream that's actually already come true. So another way that you can upcycle plastic is actually to make art out of it, right? And so I'm lucky enough that I got awarded this Denning Visiting Artist Fund to work with Jean Shin, like world famous. Oh, you can't see her because, oh, that's so sad. Well, she's here. She's in the middle there. But Jean Shin, who's this incredible artist who is like a real advocate and activist in climate change. And so we got this grant, and the plan is that we want to create art installations both here at Stanford and then also in Kenya, along with the nonprofit. And we are looking for anyone, students of all types, to come and join us, because it's very much about this journey of building this thing. It's not really about what it looks like at the end. It's all that we learn about our waste and our world as we do this together. So we're calling all artists, writing, science students, anyone really, and faculty to come and join us. She's already had a first visit here, but the plan is that this installation will happen in February. And Sam is here and she's helping lead some of this work. So if you're interested in this, come talk to me and Sam afterwards. We really want you. And then in Kenya, Jean is coming with me to Kenya in April, and we're unveiling something, I'm not exactly sure what it'll be yet, but we're going to unveil the piece in Kenya on Earth Day. So please reach out. And I just wanted to show some pictures of Jean's amazing work. So she oftentimes repurposes discarded items, something you'd call trash, something you're throwing away, and makes something useful and beautiful out of it. So those were umbrellas in New York. Dele, this is for you. Yeah. This is cell phones. There's a master of e-waste over there, if anybody's interested in that. And then this is a newer piece of hers where she actually worked with a scientist on it. So it turns out that freshwater mussel numbers were decimated because we killed them all to make these fancy buttons. Because in the 1800s, like when you had these fancy buttons, it meant you were fancy. And so we killed all of the mussels, which were actually cleaning our rivers. And so there's a scientist who now has figured out how to grow these like in the lab, right? And they're reintroducing them. And so those little glass vials there actually have mussels that are cleaning 15 gallons of water a day each, right? And so they're reintroducing them. So anyway, Jean's literally amazing. This is one of her sculptures using plastics, the Mountain Dew bottles. And see, it looks like corn, right? Because we think that like we grow corn in America to feed people, but actually we grow corn to make. Yeah, Mountain Dew, pretty much, exactly. High fructose corn syrup. So that's this, and this is another one. It's called invasives, which is like plastic, over the ocean. And then the last straw, the ocean's choked with straws, right? So anyway, I can't tell you how excited I am about this collaboration. It's amazing. And please join us. So I'm wrapping up here, but one thing that I just want to make very obvious is that I'm just here as a spokesperson, and I represent a whole lot of incredibly smart, brilliant people who are so dedicated to this work. And like my life is a joy because I get to work and learn and have fun and have problems, with the work because it's difficult. Sometimes there are challenges, right? But I mean, partnership is everything. I have on my signature stamp, my favorite quote, or it's an African proverb, is if you want to go fast, go alone. If you want to go far, go together. And I really, really believe in this, that we would have never, it's all about this. And, our work is interdisciplinary. This is mandatory, but it's just so fun and makes everything so much deeper and better. Speaking of partnerships, so me and Anna Stewart Ibarra, there on the left, she's another dengue epidemiologist. We've been for the last 2 years been working on editing a book that's actually on global health partnerships. And it's not really like how to do this like a prescriptive textbook. It's more of this interweaving of stories and sort of a vision for a more equitable, sustainable, and impactful partnership lens, right? And so this book has been incredible. We have so many different voices. I mean, like North, South, academics, community practitioners and partners and senior mentors and students and all kinds of generations and disciplines, indigenous folks, and more than 60 chapter authors from more than 20 countries on every continent except Antarctica. And the book has 3 sections, crowned by Mira, who's right there, our medical student, who's also an artist, crowned by her beautiful artwork. So we have a foundation section, we have a case study section, and then we have a future vision section. So again, this is going to be published next year in Springer, and we are very committed to making this an open access book because it's a book about global health partnerships and it should be free. And so we're looking for $23,000 to support that, and we're going to find it somehow. Also, I just want to bring up the task force. So Barb Ernie is right there. She is on this lovely task force with me, if you don't know Barb. So there are I know a lot of you are students and are interested in climate and health and how do you get involved? Well, come join our task force, join Stanford Climate and Health, which is a Stanford student group that is all about this. Undergraduates, medical students, everyone. And then come and work with us on our task force as part of the Stanford Climate and Health group, where Barb is leading a lot in medical education. If you're interested in medical education, please reach out to us. Sustainability, we are working with the people in healthcare, sustainable healthcare, but then also just sustainability in our labs. Sam and I, we are talking about doing waste audits in our lab. And then policy, Lisa Patel, who's the co-chair of this task force with me, is an incredible policy person and runs a medical consortium on climate change. And so she has a lot of policy projects. And then we have a lot of environmental justice and then local and global community outreach projects like the HERI nonprofit I mentioned. So please join us. And so to conclude, like, definitely, what are the lessons here of my life so far? Definitely pay attention to what your participants are telling you, right? They're always trying to lead you on the path to the next right thing. I believe that this research, I mean, everyone out there who's brilliant and excited about their career, like you're not quite sure, just become an arbovirologist because it's awesome. It really uncovers a lot of opportunities for activism and advocacy, especially in global health equity building. I'm really, the global health, like the global plastic crisis has really important health and environmental impacts. And we're really hoping that our nonprofit can tackle some of this by centering the community and kind of amplifying those voices and those ideas and building awareness and education and active engagement. And then this new art project with Jean is just going to be a fascinating journey. I don't even know what's going to happen. I love that. And so I don't know what it will be. I don't know how we will change through it, but I know I'm not going to be the same in February of 2023 as I am now. I'm going to think differently about things. And we're hoping that this is going to be a new way that we partner with a lot of different types of students and really increase outreach and just the reach of this work. And then finally, probably the most important lesson is just about partnerships, right? And how critical they are to really, our work and then all global health efforts. So I always want to thank our incredible study participants because without them, we'd have nothing to say or learn. I want to thank the students. I've had the good opportunity of training so many students over the years, both in country and Kenya, but then other countries of the world, and then here in the US, and they are really the legacy of this work because the research dollars always end, right? But the students, if they're ignited, right, will stay on to that cause and change things for the better. And so they are our legacy and our sustainability. And then again, I am just one person up here talking, but I represent a whole village of people. And this is just some of our team in Kenya. And then I have my incredible Stanford team, some of which are in the room. And then again, these guys in the middle here. So again, I mentioned Francis Machuku from Technical University of Mombasa, and then Bryson and Dengue, who is at KEMRI. And those guys really led the work in Kenya and are co-founders with me of the nonprofit. And then I also want to thank Juma Nasoro, who is the leader, and you guys will meet him on November 30th. I guess he'll be there, and so will you. But he's amazing. He runs a nonprofit. And then our funding sources, NIH, the Bechtel Faculty Scholar Award, BOVA, and then friends and family who are supporting the nonprofit. And I thank you for your attention. So thank you. Barb, please.
Questions from the room.
I think that works. Yeah. Thank you so much for that amazing presentation. I'm able to get one more round of applause after a vote. As Alison mentioned, we've got about 10 minutes to just do questions. We have a list of questions that have been pre-submitted, but I figured since we're all here, I'm going to open it up to the floor. And now, since we've already got, please feel free to.
Exactly, run to another thing. Climate change, actually, but I was wondering if HERI-Kenya is doing anything to address the root of the problem, which is the use of plastic. And here we have no excuse, but in Africa, I get it. They don't have safe drinking water. Getting bottled water saves lives there versus us. We don't have a good excuse. Is there work being done to put in actual water treatment systems so they don't have to feel they need to buy plastic bottles? And or educating to just try not to buy stuff they don't really need if it's got plastic.
Yeah, so it's a very interesting question, Barb, because so most of the communities where where we are working are super, super impoverished, right? There's a lot of poverty. And my feeling is most of the people who are incredibly impoverished barely use any plastic, actually. Like they are not using a lot of plastic. There's a lot of plastic, so everyone knows like the dirty secret, right? Like it's all our plastic. Like we in the rich countries ship our plastic to the poor countries of the world, right? China was taking it until 2016, then they stopped. Now our plastic goes to, well, Africa is trying to say no, but still a lot of our plastic goes to Africa and then Vietnam, a lot of, South Asian countries and so forth. So there, it's so important, like the water issue. I mean, this is so funny. So we were on the phone with Jean this morning and a nonprofit, just thinking about this art space. And what we want to do in Kenya is actually make whatever it is like useful and functional, like maybe make something that provides shade or like make a structure like shelter. Like I always have this dream of like making a community center out of plastic waste or something, or like some place to sit. And I was like, woo, because then she said, or like a fountain. And I was like, oh, maybe we can like dig a well and have a safe, available source of water for people. And then our like thing around, right? I mean, there are a lot of people working in water in this space. I've met with people who have really incredible new ideas about like water treatment and those sorts of things. And the safe, reliable access to clean water is definitely part of the problem. So it's definitely something that we've had like in our purview and we're thinking about. Yeah, thank you for bringing that up.
How much do you need? Like, I'm sure you've done the math, like, how much plastic you cleaned up or the kids cleaned up in that village. So they could probably already figured out like how much plastic is in all the villages in the area or the country. How much plastic the container can recycle. So like how many containers would solve the problem?
Yeah. So there's continually more and more coming, right? So just like Barb just brought up, like there's the upstream issue, right? So even if we deal with all the plastic that's on the ground, more is coming, right? Exponentially. It keeps, because we don't have a lot of good plastic alternatives, right? So just like what she mentioned, what we're trying to do is actually change kind of mindset, and make make things out of the plastic that we're stuck with because it's not going anywhere, right? And then also have alternatives, right? And there needs to be a lot more research and everything put behind all of those alternatives. We don't exactly know how much plastic we really have. We actually have a project right now that's linked to the nonprofit where we're using drones to actually like map trash in our area, because we don't know all the plastic everywhere that it is. And so we're trying to actually get better estimates of that. It seems like something we should know, but we don't know exactly how much is there. And with that unit, we've never tried it, right? Like this unit has been used and is being used right now in the UK, like in this town in the UK, right? Like this little cute town, and they have one of these and they're getting rid of all their plastic. And so they're like, it's just coming. It's like a new thing. And so, our dream at first was just to have one and pilot it and see if it actually works for us, right? If you're asking me like how many units, if I would imagine like how many units would we need to, deal with the plastic that's on the ground right now in Kenya, it would be many, 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 many. It is a lot. It's hard. It would be hard for me to estimate it, but it's a lot. I know for those of you who also work, I met someone, I wonder if she's still here from Tanzania. Yeah. Like, right? Like, I don't know if it's the same as Tanzania. I mean, this is not just a problem in Kenya, of course, this is a problem everywhere. It's actually a problem here. We just hide it from ourselves too. We just ship it somewhere else. So, but it's a lot, right? It's just so much. So it's hard for me to come up with a number, but it is a lot. But we need to start kind of somewhere, right? So, the reason why I want that unit is because I also want to bring women to the space. I think it could be incredible to, we're trying to think of all kinds of innovative ways to bring women to this space because they haven't been invited and they haven't been a part of it. And I think they will have different ideas for how to upcycle, recycle, do different things with all the waste streams. And so I think that that would be a really neat way to make it like a woman-owned business and try that out.
I'm kind of unclear, no, she left. Can you be a little more clear on why the plastic is going from here to there? The plastic that you cleaned up.
Yeah.
That was all over the schoolyard and all over
Uh-huh.
the village.
Mhm.
Where did it come from? Why was it there?
So a
If it's
lot
not
of,
being,
right, so a lot of the plastic that we had there was PET. So it's a lot of plastic water bottle plastic. It gets there because tourists come and buy water and drink it. Most of the locals are drinking like 4-well water or they have other sources of water, right? So a lot of that plastic that I see is plastic water bottle plastic and not, I won't say no locals drink plastic water bottle plastic, but a lot of it comes with the tourists, right? When I'm talking about our plastic going there, it's because plastic doesn't really get recycled in the way that people think, right? I mean, that's like all a lie, right? I think everybody knows that, right? That little triangle on the bottom was just to put like the impetus on us and then to make us feel really good. We could do something with our plastic, but actually nothing's happening with the plastic. Like less than 10% of the world's plastic actually is recycled. And then, so what do you do with it? It's unsightly, right? Like we couldn't possibly have piles of plastic waste in Palo Alto, California, right? So then we take it and we ship it to people in the world who have less power than us. So that's why it's there. And that's not okay. So that, I mean, so, you know, the deeper you get into this, right, I'm sure many of you are very educated on what we're talking about right now. So there's a lot, it sounds, I don't want everybody to like leave like, oh God, it's relevant. Yeah, no, obvious, right? Like we just have to start working, right? We just have to do it, wait, you have to see, and ideas will come and people, there are a lot, I'm not the only one in the world who cares about this. All of you do, that's why you showed up tonight. And there are a lot of people with a lot more power, resources than I do, who are thinking about this problem and trying to get all of the people working together, including big oil, take accountability for this crisis, right?
I've got time for maybe one more question, and then Dr. LaBeaud, if you have a couple seconds to stick around, people can also come up and kind of close.
Yeah.
Yeah.
Okay, well, we'll stay on this end, maybe. Thank you for sharing your energy. It's so impressive and infectious. There is hope for the plastic thing. If you fly into Rwanda, you can't bring plastics into the country. And that's tied also to the role of women in making clay containers, which used to be the way people stored water before plastics. And I think it's still used in Kenya. It's a clay faucet. And I wonder in your assessment of where mosquitoes breed, if you found the kids won't see them necessarily. They get broken, but they can still get a little bit of water. But they're usually in the corner, in full spot, and they breed a lot. You can
Absolutely.
see this
They like it cooler. Yeah, no, so there are still some clay pots, but there's a lot, you know, like with jerry cans, you know, like this. Yeah, and so, but there are still some clay pots, and the mosquitoes do like to breed in those too, especially the dark ones. And but you just, if you cover them, you're okay, you know.
I'm wondering if they are appropriate, paying attention to that occupation that women used to do, and re-envisioning how this can become modernized. Something that
Oh, that's interesting. You should come. We have our next meeting at noon on Friday, Dele. Come on. It's on Zoom. I'm gonna, yeah. Okay, well, thank you guys for coming. Thank you.